Hello, I'm Dr. Pooja Shenoy, a certified birth doula at Fernandez Hospital. Let's now discuss the first part of birth tools. Let's ask ourselves, does birth space matter? Does birth space alter the birth outcomes? Are there any birth tools that can support upright birth? If you see these images, what do you observe? These are birth environments that are very medicalized. You can see there are a lot of electronic gadgets and medical equipments in these environments. All of this adds to the fear as well as it depersonalizes a woman's birth space. Birth Space, an evidence-based guide to birth environment design, says the birth space should promote safety and satisfaction to the woman. The bed should not be the focal point in the room. Use tools that encourage the non-supine positions for labor and birth. For reducing primary cesareans, in 2016, there was an article that said, environment encourages non-pharmacological methods of pain relief and comfort in labor. This should be offered with dim lighting, birth balls, birth stools, rocking chairs. What are birth tools? Birth tools encourage upright positions for labor and birth. They facilitate a woman's choice and encourages gravity. There are a lot of birth tools that we can help women with during labor and birth. Some of these are cub, peanut ball, birth stool, rebozo, and various massage tools. In this module, we will learn 3 birth tools: cub, the peanut ball, and the birth ball. Let's begin with the birth ball. This is also called as a fitness ball, an exercise ball, or a physio ball. This was first used by physiotherapists in 1963 for relief of back pain. Birth ball as a childbirth tool was introduced in the 1980s. Let's see what are the benefits of using birth ball in pregnancy. There are lesser chances of back pain when the mother uses a birth ball through pregnancy. This can be used any time from 12 weeks of the pregnancy onwards. This also promotes optimal fetal positioning through pregnancy. Benefits of the birth ball in labor. It helps in movement and mobility. It helps the woman feel in control and thus helping in building their confidence. It reduces the discomfort of labor and it facilitates descent and the progress of labor. It also supports the perineum because when the woman is sitting on a birth ball, there is a micro massage at the perineum that is happening, and this helps in supporting the perineum. Benefits of the birth ball in the postpartum period: it soothes a crying and a fussy baby, as well as it helps in the woman achieve postpartum fitness after birth. Now, it is really not one size fits all. Depending on the height of the woman, the ball should be suggested for her. An important tip to remember over here is, when the woman is sitting on the birth ball, her thighs should be parallel to the floor, or in simple words, the knees and the hips should be in a straight line. But if you notice that the knees are higher than the hips, that is not the right size for the woman. You would need to help her with stepping up one size. Now, there are a lot of positions that the woman can use with the birth ball, be it in pregnancy or during labor. So, you can see a couple of images here. In the first image, you can see that the woman is on an all-fours position on the bed. This can also be achieved on the floor depending on the woman's comfort and convenience. In the second image, the woman is standing, spaced out, and she is leaning forward on the birth ball. In these images, you can see that the woman is using gravity to help in the descent of the fetal head as well as the progress of labor. The third image is when the woman can be made to do different movements on the birth ball. In the fourth image, you can see the head end of the bed is brought up and the lower part of the bed is brought lower down. So you can see this is also called as the throne position, where the woman is sitting in the middle part of the bed with a birth ball placed between her feet and she is resting on the birth ball. This is an asymmetrical lunge. where the woman is standing with one foot on the floor and the other foot placed on the bed, and she is leaning forward and resting on a birth ball that's placed on the bed. Now let us watch this video which shows the different effects on the pelvis when a birth ball is used. So let us discuss what is the evidence of a birth ball. This was a survey that was conducted in the US. It was called as Listening to Mothers Part 3 Pregnancy and Birth. As a part of this survey, 2,048 women participated who were all in labor, and they were offered the different comfort measures through the process of labor and childbirth. 10% of women said that with the use of birth ball, they were able to manage their labors. In 2019, a randomized controlled trial was carried out where women in labor were divided into two groups. One was a control group where women followed a series of pre-established exercises on the birthing ball in labor, and the second group were given an injection of haloperidol and pethidine subcutaneously as pain relief. Post-delivery satisfaction was measured by the Mackey Satisfaction Childbirth Scale in the first 48 to 72 hours after birth. And it was found that there was an increased satisfactory rate in the birth ball group, as well as a higher sense of body control in the group that used the birth ball. Another inflatable tool that is very effective in labor is the peanut ball. It is most likely recommended when the laboring woman needs to remain in bed due to an epidural, or if she is exhausted and just wishes to rest for a while. These are some different positions with the peanut ball. This is the side lying position where the woman is turned to the side of her comfort and the peanut ball is placed between her thighs. This is the side lying tuck position where, like in the previous slide, the woman is turned to her side and the peanut ball is placed between her thighs and the feet are tucked towards her abdomen. This is the semi-sitting lunge position where the woman is sitting slightly upright and the peanut ball is placed below one knee. The other knee is placed by the side of the peanut ball. 20 minutes later, this peanut ball can be placed below the opposite knee. This is the side-lying runner's position where it looks like the woman is running. She is turning onto her side. One leg is placed on the ball, flexed, and the other knee is facing behind her. This is the all-fours position with the peanut ball, where the lower end of the bed is brought slightly lower down. The woman is rolled over onto the bottom end of the bed and she is resting on a peanut ball placed in the middle part of the bed. This is a squat position that the woman can adopt with a peanut ball. Now in this video, you can see the woman is in an upright position. The peanut ball is placed below one knee while the opposite knee is slightly bent and placed by the side of the peanut ball. "20 minutes to half an hour later, this peanut ball can be placed below the opposite knee. So as you can see, this helps in widening the pelvic diameters, and of course, the woman is using gravity to facilitate the baby to move down. Now, if the woman does not have a peanut ball, say for example when she is at home, she can stack up some pillows and place it below each knee for about 20 minutes to half an hour. Now let's see the side lying position with the peanut ball. So you can see the woman is turning towards her side with the peanut ball placed between her thighs and the feet are tucked towards her abdomen. The partner or the doula can rock the leg on top of the ball, and this promotes relaxation. Another position is when the peanut ball can be slightly tilted such that the thigh is perpendicular to the peanut ball. And again, you can rock the leg on top of the ball, promotes relaxation. What is the evidence of the peanut ball? In 2011, a randomized controlled trial was conducted where in 200 women with uncomplicated pregnancies who were under epidural were divided into two groups. The first group was provided with a set of positions with the peanut ball, and the second group had no peanut ball. It was found that the first and the second stages of labor were shorter in women who used the peanut ball, and the use of an instrument like a forceps or a vacuum was lower in the peanut ball group. Let us now learn about the next birth tool, which is a cub. This is a modern version of the traditional birthing stool. Cub stands for Comfortable Upright Birth. In these images, you can see the all fours position, where the woman is on her knees, resting on an inflatable cub. If she has any knee joint pains, a pillow can be placed below her knee to give a padded support to her knees. The next is an asymmetrical lunge. In this position, the woman is supported on the peanut ball in a lunge position. Again, if she has knee joint pains, we can help with using a pillow below the bent knee. The next is the sitting position, where either one or two tires of the cub are inflated and the woman is sitting on the cub. This promotes the use of gravity, which again helps in the descent of the baby as well as the progress of labor. This is a supported sitting position, where a similar position is adopted as the previous slide, but the woman is resting back onto her birth companion or a doula. So what is the evidence of the cub? There is dearth of evidence in literature in terms of a randomized controlled trial on the use of a cub. Cub can be used during labor and childbirth as it supports the physiology of birth. Thank you.